Well, perhaps you could put the question to us, so do we act according to our hunch or perception, or do we base ourselves on evidence and data in order to guide children to services that are well adapted to meet their needs? Well, without a doubt, it's not a question of acting on perceptions, but acting in terms of habits. That's how things happen at the moment with services. It's the habits that we have rather than actually understanding data. That's how we act. The fact that young people have multiple and complex needs is not really reflected in the organization of the services that are offered. And that's always the starting point here. We don't take into account the need, but rather we just concentrate on the symptom that's being presented. And depending on the level of vulnerability of this child, this can then trigger off various mechanisms, perhaps a child of 4 years of age or the same child when they're 12 or 13 once again is caught stealing from a shop or is committing an act of vandalism, depending on the district. For example, if they live near people who've got a nice car, then this same act will lead to them being referred to a psychiatrist, a private psychiatrist preferably, who will try to understand the context behind this gesture, the developmental context as well, and perhaps will be a psychiatrist who will be very enlightened and will then decide to meet with the family as well and work on relationships with this family. Whereas if this happens in a district that's more disadvantaged, but not the most extreme case, the same act will mean that we'll call up the youth protection services, and it's under the cover of these services that this young person will get access to services which will be defined in a much more specific and narrow fashion. Either we'll say that we've got negligent parents, or it'll be expressed in terms of a behavioural problem with the young person. Now, in the most disadvantaged district, it won't be youth protection services, but the police that be called up, and we'll redefine the same act and say it's actually a criminal act. So the same gesture, the same need, the same context can be interpreted or lead to three completely different responses. And it's not services that are defined on the basis of evidence and understanding the needs of the young person, but rather it's very much defined in terms of the economic context that defines which services are actually offered. So that is our first challenge. We're talking about vulnerable children. But do they really have access to the same quality of services? Do they have the same range of services compared to children from middle-class backgrounds who've got the financial means, thanks to their parents, to have access to services which are not necessarily defined, that do not necessarily fit within this legal or socio-legal lens, but rather they underline the developmental need of the young person and their family context. Nick and Julien, would you like to add something to this? Yes, this question of data, evidence, the problem is that in Canada, the government does not believe in science and scientific data. And they're actually removing funding from scientists who are trying to come up with these data. In Quebec, at the moment, the same thing is happening. The public health departments are prevented from conducting studies on how the health services actually function and their performance level. This is a mandate that has been removed from them recently. I don't know if you're aware of that, but that is in fact the case. And the government keeps saying we don't have any money, the coffers are empty. But it's always a question of priorities. That's what it boils down to. I could make a suggestion. You can find lots of money when you don't need to spend it. Does Canada really need to have an army, for example? I don't think so. Costa Rica has not had an army for quite a number of years now. And they live in a very tumultuous and, in fact, dangerous environment. But they haven't come up against any difficulties with this absence of an army. So perhaps we could draw on that example, and perhaps we should invest more in social infrastructure instead of the army. Dr. Julien. Well, it's difficult to follow on after these comments, but I'd like to add something nevertheless. An important point which follows on from this question is the fact that when we're working in very impoverished situations or where there's a great deal of vulnerability, sometimes the danger is that we might have lots of people who've got a great deal of goodwill. There's volunteers involved, teachers who have made this choice to work in a more vulnerable environment. It's a choice from their heart. And you can have donors as well who decide to target a certain community group. And they too are acting from the heart. But it's not based on scientific data. Rather, it's based on their feelings. And it's something that doesn't just flow from religion. It may be a more humanistic approach. But the danger there is that it's based on habits and perceptions. And it's very ethnocentric. You're coming to help, but you're bringing in your culture. You're importing or imposing your culture on this other group. You can see this in a multi-ethnic environment, but also in a very impoverished environment. And often that kind of falsifies the image, because scientific data is not about showing things. If we were talking about parental education, I hope we're going to talk about that again. There's lots of people who want to educate parents who are bad, parents who don't know anything, who've never seen anything, who don't know how to bring up their children. And there's this big problem of negligence and how we actually interpret this. That's a major point. And there's a new term, the risk of negligence, which is emerging now. And sometimes that means that the Youth Protection Department will remain involved, remain vigilant, because there's a risk of negligence. But often I've been shocked and I've had to intervene on this, because in the Act, as it said, risk of negligence or negligence. What do we find in the Act? And people are really falsifying the situation. And as we've heard unanimously this morning, is that you have to pay attention of their culture, because it's part of your identity. It constructs your identity, but it's not the same culture that you're going to deal with as a stakeholder or as a caregiver. And you have to be open and listen to the other culture. It's a question of transculturality, and also with our culture there's lots of different social strata, different ways of living with these populations. So we have to line ourselves up with the scientific data. As everyone has said this morning, we have to come close to these people, listen to them, and influence people by our acts. And often indirectly, as has already been said, the impact of our actions with their own culture will have an impact on the other culture without imposing it on the other culture, and it'll be up to them to decide how to use this. I don't know if that adds up, but for me this is a fundamental point. Of course, we all want to have good people. We all want to have good teachers. It's extraordinary, the energy that they pour into this to try and save these children, but that's not what we want to do. And it comes back to this question of the colonialist approach versus a more comprehensive, integrated approach, which allows the other person to be empowered. When we're colonialists, we remove power, and we may be acting in good faith, but we have to tread carefully.